Thank you, and thank you, Sue, for that introduction. I'm assuming everyone can hear me. If there's a problem, let me know. Um, can I start, as solicitors always start, with a disclaimer? I wasn't around for most of the hearings in Module 2. I was actually abroad, so a lot of what I tell you will be based on summaries that our firm has prepared from the hearings. And I think it's also useful to start by explaining my stance, at least, on public inquiries. The way I see it is, certainly in this case and in most cases, there's a three-part fight. The first fight and challenge is to get a public inquiry set up. And we succeeded in that, but quite late in the process. The hope of the COVID bereaved Families for Justice was that we'd have had an inquiry before lockdown 2 and would have been able to persuade the government to bring forward lockdown 2. Johnson, for obvious reasons, although he eventually agreed to an inquiry, made sure that it was delayed for quite a long time. So that's part one of the fight. The second fight is now, and that's getting the inquiry to address the right issues and to hear the right evidence, and one hopes eventually to come up with the right recommendations. Now, we probably all have our own ideas of what is the right recommendation in any particular case. So that's something that perhaps you might want to raise questions about later. And then the third fight is to get those recommendations implemented. And if you think the recommendations are wrong, the fight would be to get what you think are the right steps implemented. So it's not necessarily exactly the same as the recommendations that the inquiry comes up with. As far as the recommendations itself are concerned, it's worth bearing in mind a few things. Firstly, as the chair, Baroness Hallett, made clear at the end of today, her recommendations are not just based on the oral evidence that we've been following, it's also based on the documentary evidence that has been filed, some of which you may have seen, a lot of which you probably haven't seen. And I think she made that comment probably in response to newspaper reports. So having sort of laid out that framework, I'm going to, I'm afraid, be quite boring and do a little bit of reading to you. First thing I wanted to read is the provisional outline of scope, which I think became the final outline of scope, and just the first paragraph of that. There's a couple of pages on the scope of this particular module, Module 2. And what it says is this module will look at and make recommendations upon the UK's core political and administrative decision-making in relation to the COVID-19 pandemic between early January 20 until February 2022. When the remaining COVID restrictions were lifted. It will pay particular scrutiny to the decisions taken by the Prime Minister and the Cabinet as advised by the civil service, senior political, scientific and medical advisors and relevant Cabinet subcommittees between early January and late March 2020, when the first national lockdown was imposed. So although it's looking at a 2-year period, Jan 2020 until Feb 2022, the focus was on the first 3 months, January to end March 2020. So that's also worth bearing in mind when you're looking at the evidence. The other point to bear in mind is, of course, as you all know, the module that is just about to finish is Module 2. We already had Module 1, which looked at preparedness. What were the conclusions of Module 1? Well, we don't yet know what the chair of the inquiry has concluded. But it seems to me, at least, that it would be impossible to conclude that the country was properly prepared for COVID or indeed for any pandemic when it arrived. So the starting point almost for Module 2, I would assume, is that we weren't properly prepared for the pandemic. Now, once you've got that starting point that you aren't properly prepared, it's almost inevitable that there are going to be problems with the decision-making once the pandemic reached our shores, or even before the pandemic reached our shores. So again, that's our base for the Module 2 evidence. So let me then go to the opening statement from Hugo Keith, who's counsel to the inquiry. And a few points that he made. he said, Mr. Cummings will say in his evidence that the government had a deliberate strategy of herd immunity. On 2nd March, he sent a text message to Lee Kane saying the PM doesn't think it will be a big deal and main danger is the economy. 5th March, Sage concluded no evidence that banning mass gatherings would reduce transmission. 10th March, Cheltenham Festival and first outbreak in care home. 12th March, text from Cummings. We've got big problems coming. The Cabinet Office is terrifyingly shit. No plans, totally behind the pace. We must announce today, stay home. And then he moved on to Patrick Valence's diaries. And just in passing, you'll know that Patrick Valence was very upset that his diaries were being used. They were the only set of diaries that have been made available. Everyone is supposed to make full disclosure of all relevant information to the COVID inquiry, and that simply hasn't happened. I think it's very unlikely, for instance, that Johnson hasn't got diaries. We do know about the missing WhatsApp messages from Johnson's phones. We know about Sunak's missing WhatsApp messages, so we already know, and it's admitted, that not all relevant evidence has been put to the inquiry, so it already labours under that disadvantage. And frankly, without WhatsApps and without Valence's diary, we'd have had a very different picture painted before the inquiry of the government actions taken. So going on to what Hugo Keith quotes from Valence's diaries, he says, 9th July, the PM cancelled a big announcement and has gone more cautious. The PM is simply not consistent as he wasn't at the beginning. 13th July, this ridiculous flip-flopping is getting worse. 28th July, the chief medical officer and I are both worried about the extreme inconsistency from the Prime Minister lurching from open everything to panic. Hugo Keith then went on to eat out to help out and says it didn't appear to have been discussed with the chief medical officer or the chief scientific advisor, and that was the evidence that later came out. Whitty and Valence's written evidence is that had they been consulted, they would have advised it was highly likely to increase transmission. So all of that is taken from Hugo Keith's opening, which explains the view that Hugo Keith had at the beginning of Module 2 as to what the evidence was likely to show. And I don't think there's anything in that opening that he'll later change his mind about having heard the evidence. And why I'm reading to you from Hugo Keith's opening is because the conclusions and the recommendations that the chair draws up at the end of this module will very largely be informed by Hugo Keith and his team, who will probably draw up the first draft, I suspect, that the chair will then look at, possibly under her direction. So what Hugo Keith says in public is very important and helps us understand what the chair is likely to say later. I was going to pick a selection of evidence from the weeks of evidence now. So week 2, after all the opening speeches, we heard from Professors Shakespeare and Watson, who were experts on structural inequalities faced by disabled people. And they said many provisions were not centrally thought about and therefore excluded from measures that were taken to protect the general population. For example, social distancing. For visually impaired people, it would be impossible for a guide dog to understand what was necessary of them. Many would need carers to assist with dressing, food, transport, etc. So to isolate might cut you off from your care and support. So that was one of the deficiencies with the system. And it's the systemic deficiencies that I find interesting as much as the actual decisions that were made. The next interesting witness was Gus O'Donnell, who was previously Cabinet Secretary until 2011. And he referred to Patrick Valence's diaries. And he said, the diary said that Simon Case says that Number 10 was at war with itself, a Carey faction with Govan, another with the SPADs, special advisors. Prime Minister was said to be caught in the middle. He, Gus O'Donnell, has spoken to all his predecessors as Cabinet Secretary and no one has seen anything like it. And that's worth mentioning because those of you who watched Boris Johnson's evidence will have seen him say, oh yeah, that's what always happens in governments, and it's just that you didn't know about it before because there weren't WhatsApps and there weren't diaries, but don't worry about it, that's how we always govern you. Simply not true. I mean, I'm sure there is an element of dysfunction and an element of people slagging off other cabinet members, but nothing like the extent which we've seen in Johnson's cabinet. The next witness I thought was interesting was in week 3. Professor Costello, Professor of Global Health and Sustainable Development and a founder member of Independent Sage. And he made the comment that if we'd followed the South Korean plan, he thinks we could have stopped upwards of 150,000 deaths, which I think is an astonishing comment, given the total figure of excess deaths. But I think it's, well, I think it's possible that the inquiry will conclude that had we followed the South Korean plan, which was earlier lockdown, more rigorous confinement of people and more rigorous measures earlier on, we would have saved more lives. And arguably, we wouldn't have had to have been as restrictive later on in the process. Professor John Edmonds, Department of Infectious Disease Epidemiology, was talking about Eat Out to Help Out. And he said that scheme made him angry, and he's still angry about it. It was one thing taking your foot off the brake, which is what they've been doing by easing the restrictions, but to put your foot on the accelerator seemed to him to be perverse. And to spend public money to do that when 40,000 people had just died. This was a scheme to encourage people to take an epidemiological risk. And that's something that was discussed today with Sunak, whose response seems to be, well, we'd already decided that the settings, that's to say restaurants, were safe. So it didn't really make any difference if more people were encouraged to eat in the restaurant. And there's just no logic to that position and no truth in it. And we might get back to that when we get to Sunak's evidence. Week 4, we heard from Martin Reynolds, former Principal Private Secretary to the Prime Minister. And he was talking about WhatsApps. And apologies for jumping about, but I'm taking the evidence chronologically. So I do jump about from one topic to another. I'll try and draw the threads together at the end. He'd created a new WhatsApp group called PM Updates on the 15th of April, just a matter of a few weeks before Mr. Johnson announced the public inquiry to Parliament. This is 2021. He turned on the disappearing message function in the WhatsApp group, meaning that messages would disappear from the chat 7 days after they're sent. He couldn't explain why he did this, saying, I don't believe it was intended to prevent the inquiry from having sight of them. It could be that I was worried about someone screenshotting exchanges. Although the WhatsApp messages are not available, he's confident that all the content will be available in emails, which, again, as we've seen, is just not so. And he did say, it's fair to say the PM did blow hot and cold on some issues, including the most vital ones. I've highlighted Dominic Cummings. I have to say, it's difficult to predict how much weight the chair of the inquiry will give to his evidence, and which is a shame in a way, because his WhatsApps were, if taken at face value, very revealing. But there is the possibility for the chair simply to say, I just don't accept what he said is a true description of what happened, which from our point of view would be unfortunate, because we think it helps to show the dysfunction within government. And even if he was making things up, that itself is indicative of the dysfunction within government at the time, given the position he had. So anyway, he was former advisor to the Prime Minister. He highlighted problems with the Cabinet Office. He said there was a mix of a lot of the wrong people in the wrong job. No real scrutiny, culture of classifying things to hide mistakes and scrutiny. Management was bad. The senior people themselves didn't know who was in charge of what. It is the Prime Minister who was responsible for the wrong people remaining in crucial jobs in the Cabinet Office. He said the question of plans for vulnerable people was almost entirely, appallingly neglected by the planning system. On the 19th of March, they realised there was essentially no shielding plan. A junior official tried to raise a warning about domestic abuse and children in care, but the system never properly listened to her. I'm sure you'll have read a lot more of the evidence of Dominic Cummings in the press if you didn't watch and listen to it yourself. Then Helen McNamara followed on from him, and she was, I thought, quite an impressive witness. Former Deputy Cabinet Secretary. He supported Mark Sedwill in his role as Cabinet Secretary. And she said she wasn't sure whether there would ever have been a normal pattern of working for Mr. Johnson. The monomaniacal focus on Brexit and what was communicated to him was everything else could wait until that was settled. The Cabinet Office was told time and time again by the Health Secretary, Matt Hancock, they had plans in place. That was said in her hearing. There was no ambiguity. She thought his confidence was based on having seen the plans and assuring himself. She was surprised to realise that what he said wasn't true. And we've heard from quite a few witnesses that there was no trust in what Hancock was saying, and that there were no real plans in place. She says on Friday the 13th, doesn't say what month, but she walked into the Prime Minister's study, but the Prime Minister was not there. Dominic Cummings was there with others. She had just been talking to Mark Sweeney. Sweeney said he had been told for years that there was a plan, but there is no plan and they are in huge trouble. He then said the country is heading for a disaster and they are going to kill thousands of people. And then I think lastly, I'll mention Simon Ridley, former head of the Cabinet Office Task Force. And he was talking about the transfer from hospital to care homes. And he says guidance suggested that care homes should accept patients if they were asymptomatic, even if they had not received a COVID test. This was March 2020, wasn't it? No assurance had ever been given that patients would only be moved following a negative test. It was a constant debate whether there was a need for testing and whether the system was able to meet that number of tests. On the 3rd of April, in Alex Burns' email, there was a reference to lack of strategy for care homes. Once someone gets it in one of those places, many people die. Have we considered extra measures or guidance? So the overall picture, that I think is all I will read from specific witnesses. I haven't mentioned the evidence of Johnson or Sunak yet, and I'll get to that. But the impression I have of the political witnesses, and in particular Johnson and Sunak, is that they did not give evidence that is likely to be helpful to the inquiry in drawing its conclusions. That's because, for most of the part, they were giving political answers to forensic questions. And I got the impression that the two worlds, the legal world of the inquiry and the political world of the politicians, they just weren't meeting. The number of times I was trying to think of the last question put to Sunak this morning from Hugo Keith was a question that really just had a yes or no answer. It was whether he or someone else in a particular meeting had made various derogatory comments. It doesn't really matter what. And Sunak's answer was a 3-minute speech about how marvellous his policies had been. It just didn't answer the question at all. And that happens repeatedly. And one of the drawbacks of the timetable that is being imposed by the chair on the inquiry is that Hugo Keith, possibly in order to meet that timetable, and I'm being charitable to him in saying that, doesn't sufficiently explore the answers. I'm not sure if that's the impression you get. The impression I constantly get is that there's an answer from a politician, for instance, and in your mind, you're screaming the next question that should be put to the witness, and it just isn't put. He moves on to the next question on his list. And that's something I found particularly frustrating about this inquiry, that issues are not being sufficiently explored. And the hope is that the chair gets it, if you know what I mean, that she understands the implications from the avoiding techniques of the witness. But yeah, I don't think either Johnson or Sunak were particularly helpful. I think they were both pushing their political agendas, and I don't think they answered most of the questions. But trying to draw those threads together, where do we get to? I think we get a clear picture of dysfunctional government, partly due to personalities, partly perhaps due to the system. I think we get a clear picture of poor planning in early stages, although that's denied by the politicians. This awful picture of transfers from hospitals to care homes without testing, without any adequate preparations, without an understanding, I think, of the way different care homes functioned. And we'll be looking at that in later modules. But even in this module, I think it was apparent and will have been apparent to the chair that insufficient thought was given to that. I think it's likely that she will find that the Eat Out to Help Out scheme was not properly considered. I don't think she'll accept Sunak's argument that because they had decided it was safe to reopen restaurants, it logically followed that it was equally safe to cram people into those restaurants. I think it logically follows that the more people you put in a setting, the higher the risk is of infections. I mean, I just don't see how, whatever Sunak was saying, you can argue with that. So I think it's likely that she will find that. I think she will definitely find that there was no consultation with the medical advisors before the decision was made. The answer, the politician's answer to that is, well, they had time to object later, but I don't think that's much of an answer, really. Especially given the dynamics, I think it's quite difficult for the medical advisors to object later to a decision that has already been made by a prime minister and endorsed by the Chancellor of the Exchequer. On long COVID, it seems to be accepted, and Sunak said today, well, we didn't really know much about it in the early stages. And I think they can be forgiven for that, but I think their definition of early stages doesn't match our definition of early stages. So it's the timing that's important there. I think there was time for them to take long COVID into account, or even if it wasn't called long COVID, to take into the account the likelihood that people would survive COVID, but that there would be after effects. And even, I mean, I think we'll be looking in later modules at the support that should now be being offered. Bear in mind that the emphasis in this module was on the first 3 months of 2020. I think it will be accepted that there was poor data provided. For instance, the decisions on track and trace, which again will be looked at much later, but the early indications are that the decisions taken on track and trace were unhelpful to managing the pandemic. I haven't mentioned Hancock. I mean, the position with Hancock is interesting in that there were so many people that were saying he was a liar about everything. And I don't know if the chair will make a decision on that. I suspect she'll try and duck that question. And in a way, I think the way I'd summarize this is there were some very bad actors in place in the political arena. Johnson was absolutely the worst character to have in place to deal with this. There's a disadvantage for the process in that it becomes all too easy for the chair to say, well, this was a result of having the wrong people in place and blaming the people. Blaming the people is unhelpful because it's then easy to conclude, well, if the right people had been in place, this wouldn't have been a problem. And I just don't think that's right. I think the process is wrong and the system is wrong, and we need a lot of improvement to the process and system. And I just hope the chair doesn't duck examination of that and focus on individual actors. But there's a tension there between accountability and improving things for the future, saving lives in the future. Because understandably, a lot of people want some form of accountability, which at the very least in the inquiry will include some form of criticism of individuals and their actions. But we shouldn't take our eye off examining the system and whether there are problems with the system and whether there's room for improvement in the system. So I think I've spoken for about 25 minutes. Sue wanted me to mention duty of candour. I'll probably get that in response to some questions, no doubt. So can I open it up to questions now?
Boo, you're muted.
I've now got a flat battery, so I can't put my headphones in to charge my phone. So if you could take over, Joan, that would be great. Thank you so much, Elkan. That was brilliant. If you could say something about Hillsborough law, because I don't think people know about Hillsborough law.
Shall I say that before questions, or are there questions that will lead to
why don't you bring it in when you're summing up at the end? Or
okay.
because because I think that otherwise it becomes a different subject, doesn't it? Right, thanks, Sue. So hope you can keep. I can see Tony and I can see Jonathan, and I'm not sure which of you was first, so I'm going to take you in the order I can see you on my screen, which is Tony.
Thanks very much, Joan, and thank you very much, Elkan. Elkan, that was a brilliant summary. You're right that people were screaming at the screens or in their minds about why don't you ask the next question, why don't you follow up? Two things about that. Why did Keith and others not interrupt these 3 or 4 minute monologues that were clear deflections from what they'd been asked? Is that not allowed in the process? And in future modules, will there be any opportunity to go back to some of these issues where we feel sometimes the evidence hasn't been nailed? And an interest of our own from Key Branch's public's point of view, we raised it in our inquiry. Do you think there's any chance at all of individuals being held to account and being potentially accused of legally misconduct in public office?
Okay,
Thanks,
so sorry. Yeah, so
go ahead.
Thanks. So to answer the first question, Hugo, Keith and others are allowed to interrupt, and there was a little bit of that, but not much, I have to say. And perhaps that's because undue deference is given to the politicians. That was certainly the impression I got. Let me explain the way the process works for questions that are allowed to call participants who are not Hugo Keith. So the way it works is we get a summary of the questions that are going to be put to each witness. We, and by we I mean each call participant legal team, then says, well, we'd like to ask them A, B, C, D, and E. You're then told, well, question A is no good. We're not interested in that. You can't ask them. Question B, we quite like that. We'll add it to the questions we put to them. So Hugo might ask a question we've suggested. You can have question C. We'll let you ask question C. And then we're given a time limit for asking questions, which may be 5 minutes, maybe 8 minutes. It's very rarely as much as 10 minutes for each call participant. And this chair is, I think, a particularly strong manager. She's particularly keen on managing the process. I'd say at some expense to the process itself. Mm-hmm. So to the extent of one of the questions that Pete Weatherby, our barrister, wanted to put to a witness, she said, well, you can put it, but I've rewritten it. These are the words you're allowed to ask. Oof. So in other words, she actually phrased the question itself. There was an example, was it with Johnson, where one of the barristers, I think it was Danny Friedman, referred to, how did he put it? Ageism with an adjective before. I forget what the adjective was, but saying bad ageism, and she said, I didn't let you use those words. So it's very much micromanaged by the chair and her team. And given that, I think there is a temptation to interrupt the politicians, and there was some of that, but it's quite difficult to do it too much because you're on very limited time anyway, and you're just thinking, oh, let me get on with it and I'll get on to my next question, I think. So that answered, I think, 2 of your questions. Oh, the third question was about accountability. I don't know the answer to that. Accountability, in the sense that the inquiry may criticise the actions of individual actors, I think yes. As you probably all know, the inquiry has no powers to make any criminal findings or civil findings. So in that sense, no. But once the conclusions come out, might that lead to criminal proceedings? It's certainly possible. I don't think there is likely to be much public enthusiasm, I have to say, for criminal proceedings. What, 3 more years down the line, another 3 years to get the proceedings off the ground, probably, because the exercise that has been gone through with the inquiry would then have to be repeated via the Crown Prosecution Service and then the police. And although technically public appetite may not be strictly relevant, there is a public interest test for prosecutions. So I don't know. I'm not massively optimistic about there being criminal proceedings, I have to say.
Following on from that, Elkan,
Yeah.
Chris R, who is here, but he sent us a question earlier asking if you thought anyone would consider prosecuting Johnson for misconduct in public office, which I know from the KONP inquiry which Tony was involved in was their finding. I mean, you've sort of answered it there, but I may as well kind of butt in with that person's question now, because follow up on that, because it does sound as though your answer to that is no.
Not absolutely no. And we'll see what other evidence emerges. Although I suspect we've seen the worst of it in the WhatsApps and diaries and so on, but you never know. It's a high bar, misconduct in public office as well. There's that to consider. It still remains a possibility. I guess I'd say, putting a percentage on it, 20-25%. But I'm not, as I say, massively optimistic.
Right, Jonathan.
Thanks, Joan. And thank you, Elkan, for that really comprehensive and informative summary. I'm from Doctors in United. We submitted a Rule 9 witness statement to Module 1, but unfortunately they have barred us from Module 3, and we have a whole lot more we would like to say, but we're going to have to find another route, perhaps through the TUC. You've answered one of my questions already, thanks. And I've kept wondering why you guys, the core participant barristers and legal team, were not getting any airtime, so to speak, at the inquiry. But as you say, it seems to be very tightly controlled and managed. And it's kind of up to the solicitors at the inquiry to decide what's important and what's not important. And that, to me, kind of cuts across the whole purpose of a public inquiry. Surely you want to hear from the core participants and others what they think is important. But just to follow up on one of Tony's questions, which I don't think you remembered to answer, was, are any of the witnesses going to be recalled? Because there's several that appeared in this module who I think would be very important in Module 3. And that kind of brings me on to my second question, and that is, we heard at one point that Lady Hallett was going to might issue interim recommendations. Now, we've heard during Module 2, I think, some very important evidence, in particular around airborne transmission of the virus. We had Professor Catherine Noakes saying they knew very early on, March 2020, that it was airborne. Even Hancock admitted, I mean, he lied through his back teeth, of course, about not knowing early on, but he admitted that kind of August time, late summer 2020, he knew it was airborne. But here we are, 3 years later, where infection control in hospitals still ignores airborne transmission to the great detriment and risk of public, patients, and healthcare workers. So a topic like that, to me, i.e. the fact that this virus is airborne, would be the perfect example of something that interim recommendations should be made about. Thanks very much.
Yeah, sorry for not answering the first question. The answer about witnesses coming back in future modules is we don't know. And the reason we don't know is because it's the inquiry that decides who to call, and they tell us nearer the time, much nearer the time sometimes. I think it likely that quite a few of these people who've given evidence will be called back, and I think with Johnson and Sunak, there was an assumption on their part that they'd probably be called back. So yes, the process certainly allows for the individuals to be recalled for future modules, and it is likely that quite a few will be called back. Interim reports, yes, she said she'll do an interim report following Module 1. I think we expect it during next summer. So there's quite a delay, even though it's an interim report. One of the things I'm keen on our group addressing is that you don't have to wait for a report to take steps. So, for instance, there seems to be an acceptance that there should be a central body and a person, possibly at Secretary of State level, responsible for emergency disaster planning. And that body should be permanent. Nobody spoke out against that. Do we have to wait for the chair when Sunak, in his next cabinet reshuffle, could just appoint a minister for emergency preparedness? And that's one of the themes I want to carry forward, is that you don't necessarily have to wait for an inquiry to recommend something, or to see if it recommends something, before taking a step that is blindingly obvious, or before, as in the example you've given, stating what is blindingly obvious. Shouldn't be for the chair of the inquiry to say that necessarily. It should be for us to say it loud and long.